logistics, you all should be aware that the NBNA Day on the Hill is scheduled for Thursday, February 7th, 2019. It's going to be held at the Washington Court Hotel. And you should all have received the emails from National about how to make your hotel reservations if you are coming to Washington, D.C. We will be conducting the Hill Day from 7 a.m. to 6 p.m., and I'll talk more about the agenda in the next slide. We are requesting, as our tradition, that if you're coming to participate, that you wear red in honor of heart health in women. This is our traditional color. It helps us to make a statement when we are, as a collective force, on the Hill. In general, we really would like for all NBNA members to attend the Day on the Hill, and all are truly welcome, as are non-NBNA members. They are also allowed to attend. And in fact, we have a fair amount of students who do come to our NBNA Day. At a minimum, each chapter should really be considering sending their health policy chair and their chapter president. In terms of making your appointments with your legislatures, we really recommend that you do so as far in advance as you can. And below is a link. If you do not know who your representative is, being that the new Congress was just sworn in today and there's been quite a bit of changes, you can find out who your legislator is by clicking on that link and following the prompts. In terms of the agenda, if you've ever attended the Day on the Hill event, you will notice that the schedule, which was sent out via attachment in the announcement for the webinar, as was the various links to all of the legislative toolkit items. And I hope you have them in front of you so that you can follow along and have had an opportunity to review them. But in general, we made a few changes this year, and we're going to be starting a little earlier. Start time for the event this year will be at 7 a.m. Greetings from myself and Dr. Phillips, followed by our NBNA President, Dr. Eric Williams, will begin promptly at 7:30. Between 8 and 10 o'clock, we will have some talks from our sponsors and some updates. At 10 a.m., we're going to start the review of the legislative toolkit, similar to what we're doing with you all here this evening. At 10:30, we are going to have our symbolic march from the hotel up to the Hill, similar to what we did last year. And we're bringing this back because the membership indicated that it was something that they enjoyed doing last year. But I want to indicate that we must stay on time for our schedule, and we must leave the hotel at 10:30 for that march. We will march up to Capitol Hill. We will take a picture in front of the Capitol, and then people will be free to go do their legislative visits. We're requesting that people return back to the hotel by 12:30, in which we will have lunch and a lunchtime speaker. From 2 to 4, back at the hotel, we will have our congressional debriefing from your visits and hopefully some visits from congressional members. We will start our post-reception at 4 p.m. So the main crux of what we're going to talk about this evening is the legislative toolkit. Again, you have the links to all of the full-length versions of the 5 topics, and we're going to discuss each one of them one by one. At this point, I'm going to turn the webinar over to Dr. Phillips to discuss the first item. Dr. Phillips?
I'm here. Can you hear me?
There's a lot of feedback, Dr. Phillips.
That's not me. That's not me. That may be somebody else. That's not me.
Okay.
You know?
I think Nina has to unmute everyone. No?
Okay, do you want me to go ahead?
Can you figure out which phone is Dr. Phillips?
There's no noise in my background at all. Okay, can you hear me now? One of the first items in the toolkit, maternal mortality.
Oh my goodness.
To address maternal mortality as a leading public health issue that negatively impacts the health and well-being of all communities. Can you hear me?
I can't hear you. Nina? I need for you to mute everyone else's line except for
Maybe it's best to ask everybody else to mute their phone.
Yeah, can everyone else on the call please mute their phones, mute their lines?
Okay, can you hear me now?
Absolutely. Go ahead, Dr. Phillips.
Very good. So I was saying that one of the items in our toolkit has to do with maternal mortality. The United States has the worst rates of maternal mortality in the developed world. So therefore, we are calling upon Congress to address maternal mortality during our HEAL visits. The National Black Nurses Association supports comprehensive efforts to reduce the rates of maternal mortality and its devastating impact on the health and well-being of all communities. As you can see, there's some background and supportive information, and I would certainly encourage everyone to please take a look at your handouts in your toolkit because you'll find more detailed background information. You'll find some very specific statistics related to African American women and black women in general. So focus on giving a few highlights of why this issue is important. Again, you'll find some of those rates on your full handout. And then insert local data specific to your district or state to underscore the importance of this issue. And our departments of public health, whether that be our city departments of public health, our state departments of public health, they will all have information that's very, very specific to what's going on in our districts and on the state and city level. So it's very important to bring that data along. And if there are some real-life examples that you can also share with the office when you make your visit, that's going to be very important too. Our recommendation to legislators will focus on them supporting and co-signing the Maternal Care Act. That's the Maternal Care Access and Reducing Emergency Act, which is Maternal Care Act, Senate Bill 3363. So it's important to know beforehand whether or not your legislator has signed on to this, if they are a co-sponsor, and we'll talk about how you can find that out in just a few moments. This Maternal Care Act also focuses on implicit bias training and also some funding to the various states to implement home demonstration projects to try to curb these startling statistics. The next thing that you'll find in your toolkit addresses climate change and environmental justice. As we all know that climate change is a hot topic right now. We finally have some comprehensive data to talk about why it's important. We know that minority communities will be disproportionately impacted by climate change, and therefore the National Black Nurses Association, we also support comprehensive efforts to endorse action to address climate change initiatives, particularly those that will reduce greenhouse gas emissions and prepare communities to deal with some of these changes as we try to reduce climate-related health impacts. The background information, you will find more detailed information on your handout. And if you know of anything that relates to environmental issues in your state or in your district, it would be very important to bring that forward as well. All of our cities or states, they have a local EPA, Environmental Protection Agency, and there's always good data on their websites as well. Our recommendations to the legislators will focus on support for the Clean Air Act Authority and the United States Environmental Protection Agency. And again, you'll find more details about this issue on your handout. The next topic is the Health Equity and Accountability Act of 2018. This is something that's been around off and on for a number of years, and our lawmakers, particularly the Congressional Black Caucus and the Hispanic Caucus and the Asian Caucus, members of those caucuses have tried to move this forward. The House of Representatives Bill 5942, as well as the Senate bill, have both been introduced, and so we're asking the 116th Congress to work on passing the Health Equity and Accountability Act. It's a broadly supportive legislative initiative aimed at eliminating ethnic disparities, and it includes all kinds of things from workforce diversity, providing culturally competent care, removal of barriers to inadequate health care coverage, addressing those diseases and conditions that disproportionately impact our community. Again, focus on giving a few highlights of why this issue is important, and I think all of us can bring to the table some local data specific to our district and our state to underscore importance. And certainly as nurses, we certainly know how health disparities has impacted our communities, those that we serve, whether it's in an acute care setting or in the community-based setting. Our recommendations to our legislators is for them to focus on supporting and passing the Health Equity and Accountability Act, again, the House of Representatives Bill 5942 and Senate Bill 3660. They've all been put forth, and again, it's important to know whether or not your legislator has signed on as a co-sponsor of one of these two pieces of legislation. So again, we'll tell you how you can look that up in just a little bit. Thank you.
Thank you, Dr. Phillips. So the fourth item in the legislative toolkit is the issue on gun violence and related consequences. This is not a new issue for NBNA, but a traditional thing that we have been supporting for quite some time. The National Black Nurses Association has for some time supported the comprehensive efforts to reduce gun violence and its effects. And we are calling on the 116th Congress to address gun violence as a leading public health epidemic, because we know that these consequences disproportionately impact the communities in which we live, work, and play. And we also know when you look at the background that supports this, there are quite a few recent examples of gun violence that we can point out to our legislatures. Anything from the school violence that happened in Parkland and Sandy Hook, to churches being the Emmanuel AME Church, and the recent Tree of Life Synagogue shooting, the concert shooting in Las Vegas, the nightclub shooting at Pulse nightclub in Florida, just to name a few. The background, the local data also specific to your districts, the number of gun violence and gun-related deaths in your recent district is also something that you should point out to your legislative representatives. We are recommending a focus on support for common sense gun control, such as the 7-day waiting periods for the sale of major ammunition rounds, silencers, bullets, and the like. We are also advocating for the Gun Violence Research Act, that is House of Representative Bill 1478. This bill actually allows for the repeal of the practices that prohibit the Department of Human Health Services from sponsoring research on gun violence that is very much needed. The last and fifth item in the toolkit is the issue of combating the opioid epidemic. This issue, the National Black Nursing Association is supporting the Support Act. This was a bill that was actually passed into law by the 115th Congress, and it is now Public Law 115-271, the Substance Use Disorder Prevention that promotes opioid recovery for patients and communities, i.e. dubbed the Support Act. What we are really focusing on in terms of the background is the fact that we still have 115 Americans dying every day from opioid epidemics. And again, I would encourage you all to find out some local statistics that you can use. In terms of our recommendations to legislators, we are looking at focusing on the support for those various measures that go to support the Support Act, that go to support the implementation, of the Support Act that was passed last year. As you all know, there's one thing to pass a bill. There's another thing to make sure that the bill is appropriated the appropriate funds. There's an historic call for $10 billion in new funding in fiscal year 2019 for the Departments of Health and Human Services that will go into actually funding the various programs and initiatives that is now a part of this law that the president actually did sign into law. The last recommendation is that we're advocating for additional financial resources be made available to the National Institute for Nursing Research to support nursing research in this particular area, because we know that all around the country, it is the nurses that are on the forefront of this fight against the opioid epidemic. Dr. Phillips?
Yes. Also in your toolkit, you'll find a number of resources that will be helpful, that will help you and help all of us in terms of making our visit to our lawmakers. There's some golden rules for meeting with your legislators. Those are the steps for a successful visit. There's a keyword list of some key terms that you might hear from time to time when you're interfacing with advocates or other lawmakers. There's a Washington, D.C. Metro map, sample appointment request letters that we encourage you to use when you're trying to make appointments. Then there's a Hill Day debriefing form. We do this every year. We try to have some kind of time devoted to debriefing, and those debriefing forms are extremely important because they give us a snapshot of what occurred during the day and how we can move forward to have a better Hill Day in the following year. And then there are other selected resources. So, again, in addition to the themes that we've just discussed, please familiarize yourself with these other resources because they can be very helpful in regard to our visit to the Hill. The other thing that's extremely important is that when we go to the Hill, we want to be sure that we know whether or not our legislators have already signed up or sponsored any of the bills or laws that the NBNA is advocating for. We can look up the bills and sponsors at www.govtrack.us. And when you type in the name or the bill number of the proposed legislation or something that's already public law, you will find a list of those who have co-sponsored these particular pieces of legislation. Also, it's important that if someone or our lawmaker has already signed on or has served as a co-sponsor, it's important to acknowledge that with a note of thanks and mention this support during your appointments. And if you do your homework beforehand and you find that your legislator has not signed on or co-sponsored any of the bills that we're advocating for, this is a good time to make a strong pitch for their support. So, again, the bills or the laws on the 2019 NBNA Hill Day agenda include Maternal Care Act, Senate Bill 3363, the Health Equity and Accountability Act, and again there is support in the House and the Senate, House Bill 5942 and Senate Bill 3660, the Gun Violence Research Act, which is House Bill 1478, and the Support Act, which is already signed into law, Public Law 115-271. And again, for that piece of legislation, we're really trying to make sure that there is appropriate funding to support it. So all of the support from all of our lawmakers will be very important for that piece of legislation as well.
Sasha?
We'll have to unmute everyone again to find her.
Okay.
Okay, so let me do that now.
Yes. Everyone else, mute your phones except for Sasha.
Hello?
Sasha?
Yes.
Go ahead, Sasha.
Okay.
Hi, everyone. I know there's still one person who probably hasn't muted their phone, but I just wanted to speak on social media support of Capitol Hill Day. So just thinking about some things to consider. If you haven't liked the NBNA Facebook page, please do so. We also have an Instagram page, which is NBNA_Insta. We also have a Twitter account, which is under NBNA. Please follow all three social media platforms because we will be very active during that day. We also want you to post and do the hashtag that we're going to have for this year, which is NBNA 2019 HD. So anytime you have a caption or anytime you write like, oh, this is what I'm doing underneath your picture, just make sure you put this hashtag underneath, and that way it will get NBNA trending and will also get our event trending, and it will make it very interesting for other people that may be interested in joining NBNA because even though we are going to be physically on the Hill, we also want to make sure we put this on social media so that way we can have a presence because the presence on social media is just as important as it is in person in 2019. So also I just want to say if your chapter does not have any social media platforms, I would say start one now and have NBNA on Capitol Hill Day be one of your first events that you would basically chronicle. So chronicle your members going to NBNA on Capitol Hill Day. Chronicle everything that your chapter is doing, and then that way you can still tag National Black Nurses in it, and then there will be links. So when people go onto the NBNA page on Facebook, Instagram, or Twitter, they'll see that chapters in their area are actually active in attending the event, and that's how we'll get more members and have a presence. So when we do the march that morning, make sure you go live on one of those platforms because it's really going to create a lot of buzz, and it's such an impactful way to be present. So if anybody has any questions, just don't forget to tag people. I will be around, and so will plenty of people from social media, and I'll also have tents up on the table so that people don't forget the hashtag. Thank you.
All right. Thank you, Sasha. Dr. Phillips.
Yes. It's important that we remember that all of our topics, those that have assembled those topics have also included a reference list. We try to keep all the key points on the front page, and the reference list and other additional resources are on the back page. If you want to track legislative bills and, again, find out if there is support from your legislator for that particular piece of legislation, here's the site for tracking legislative bills. It's a good thing to know about anyway because you can trace it over time. I've been able to go into there and find how many people have signed on to the Health Equity Accountability Act. So it's just a good tool to know about. The Center for Budget and Policy Priorities is something that we've added because it's a nice reference or resource. And moving forward, if you want to take a look at some of the budget and policy priorities, this site is used quite frequently for people that are making financial and budget decisions regarding policies on Capitol Hill. And then there's another link for opioid information. The CDC has a wealth of information about the epidemic and the drug overdose issues, and they also have linkages that can give you some local data and give you a profile of what's happening nationwide. The next resource has to do with communicating with your legislative officials by email, phone, and in person. And again, there are 2 links there that you can use to communicate with your officials. Thank you.
Okay. So thank you, everyone, for your attention. What we would like to now do is go ahead and start moving into any questions that you all may have. Again, your phones are going to be muted, so type in your questions in the chat box, and Nina will read them so that we may address any questions that you all may have. While you all are doing that, one of the most common questions that we often have come up is what happens if your actual senator or congressional House representative is not physically present in the office to talk with you? What happens? So I'll go ahead and address that question because it often comes up. So at the beginning of the webinar, I introduced myself and my colleague, Dr. Janice Phillips, as both being Robert Wood Johnson Health Policy Fellows. In those capacities, we both worked on Capitol Hill in members' offices. I worked for Senator Barbara Mikulski, who at the time was the senior Democratic senator from Maryland. And part of what I did in her office was I met with various constituents from the state of Maryland who would come to D.C. to talk with the senator, and very much events like NBNA Day. There's a lot of groups that have particular or similar legislative days on the Hill. And as part of her healthcare legislative team, it was my responsibility to meet with the various constituent groups. And I did so in her office on her behalf and in her official capacity. And I say all that to say this. You may not actually speak with your senator or representative, but please understand that when you are speaking with their legislative staff, you are in essence talking to people who it is their job to take the concerns that you all are bringing as constituents back to their boss. That was my job, and I took that information gathered from people who would come to the office and gave it to the director that I reported to, and we had weekly briefings in which the chief of staff would bring out certain important information that the constituents had brought into the office. So please, when you meet with any of these congressional staff members, please treat them with the same level of respect and deference that you would as if you were speaking to the actual member of Congress themselves, because these individuals wind up being quite powerful and can be your best allies for the information that NBNA is really advocating for. And I know that Dr. Phillips would also have some comments about that.
I could not agree more. I worked in Senator Rockefeller's office, and I this is no exaggeration, I met with over 100 of constituents. They come for all kinds of reasons, asking all kinds of things. And staff are very influential in terms of not only taking that message back to their bosses, but helping to shape the boss's legislative agenda. So we cannot underestimate if we get to the Hill and our lawmaker is not there. We don't want to be discouraged if we find ourselves speaking to someone who just came out of college, for example. They are still very influential, and they're quite knowledgeable when it comes to the policymaking process. So this is our time to make the most of our visit and to be just as persuasive and passionate about the issue regardless to who we encounter when we enter into those offices.
All right. Thank you, Dr. Phillips. Nina, can you go ahead and read any questions that our members might have put into the chat, please?
No questions yet. We do have a lovely comment. Trilby would like to thank the committee for having this briefing, and she said it was a very stimulating presentation and has provided direction and ability to prepare more specifically for the visit. We got a couple questions here now.
Go ahead.
Is there a debriefing session, and what does that look like?
Dr. Phillips?
There is a debriefing session when we come back from our visits to the Hill. We ask our participants to talk about their experience, good, bad, or indifferent. Many of our members, they go with their group from their home city, and they come back and they share their experiences, which is extremely important. We have forms that we ask you to complete, and we also ask you for recommendations for improving the next year Hill Day. So the debriefing is extremely important. It gives us the opportunity to exchange and to share our experiences, to talk about what we liked, what we didn't like, what worked well, what was our strategy when we went together as a group, and then again, those recommendations that might help to shape next year's activity. So if you get something that you need to write down, please turn those forms in, and please be actively engaged throughout that debriefing time because it's extremely important.
Thank you.
Second question here. Should they send the meeting request letters to senators or to current congressmen?
So you can actually do both. We are actually visiting all members of Congress. If you remember, Congress is made up of two chambers, the Senate and the House of Representatives. Every state has two senators. So if you are in a state like Texas and New Jersey, have quite a few NBNA chapters, I would recommend that whomever gets the appointment with your senator, that you let your fellow NBNA members know so that you can go as a group, especially to the senator's offices. There really is a more impactful presence when you go to the senator's office, if we go as one group, than to have them have multiple visits on the same day. Again, because there's only two senators from every state. However, there are 435 members of the House of Representatives. So you could also make appointments with your House representative. And again, to the extent that you can, if there are chapters in the same city that have overlapping representatives, you would write to that representative to make the appointment, and whomever gets that appointment, go as a group. It's just simply more impactful. But we are targeting both houses of Congress, both the Senate side and the House side.
Mm-hmm.
Okay, we had a question about info for hotel booking. I just sent everyone the number to call the hotel to book. It is 202-628-2100. Okay, second question here. Will the current government shutdown impact our Hill visits, even though the member staff are still working?
So, in terms of the actual shutdown, that's an interesting question. As far as I know and understand, during this is actual partial shutdown. The Congress itself is actually still working and still in session, and ironically, all 535 congressional members actually still get their paycheck. the offices, to my understanding, will be open. If something happens that they will not be, we'll let people know. But and I'm not quite sure completely how things might be affected this year, but the offices of the congressional members will be open.
Mhm.
Okay, can you hear me?
Yep.
Okay. If you are unable to attend, can you participate by contacting your legislator in writing? Is there a form letter?
The committee hasn't developed a form letter. We developed a form letter for you to request an appointment. However, anybody can contact their representative at any time. So if you would like to write a letter to either of your senators or to your representative and discuss the fact that you know that your colleagues from NBNA will be on the Hill visiting on February 7th and express your concerns and support for our legislative items, you can most assuredly do that. If you think a form letter might be helpful, I will discuss that with the Health Policy Committee and see if we might not be able to put together something that might assist the membership.
And this is Janice. I also think, and we'll have it on another slide coming up, it's really important that even if we are not present on the day of our event, that we still let our lawmakers know that we are interested in these topics. And so a letter to our legislative officials is still appropriate. It doesn't necessarily have to take place during Hill Day. Hill Day, we happen to be in person, but we still need some follow-up. You know, when you go back to your home district, if you're already in your home district and you weren't able to make it to Hill Day, maybe that's a chapter event where your chapter commits itself to staying in touch with your lawmakers when they come back home, because they do have district offices, and you can still carry the message to them whether you attend Lobby Day or not.
Okay, last question. Is there a way to see who may want or need a roommate? Not really. Maybe within your chapters you can ask to set up some sort of roommate, but we don't have any sort of list of people awaiting roommates since people are doing their own hotel reservations.
Mm-hmm. Okay. So one other thing that we've got some questions about, so that the membership knows, the National Office and the Health Policy Committee has been working all along with our National Office, especially with our Executive Director, Dr. Gorham, and planning our NBNA Day on the Hill. So I want all the members to know that there is and will be correspondence going out to several of the congressional members, inviting them to come and participate in our Day on the Hill. I know that letters of invite goes out to several different departments and the entire Congressional Black Caucus, inviting them to come and speak with us and have a presence during our day. So those newer members like Ayanna Presley and the Illinois 14th Representative Lauren Underwood, who is the second black nurse ever elected to Congress, will be invited to participate in our Day on the Hill. The congressional members do historically have participated with us. We're not quite sure who will yet this year, but they are being invited. Any other questions in the queue, Nina?
We don't have a question, but more of a statement.
Okay.
One of our members, Florence Johnson, believes that it would be better to have a standardized letter on NBNA letterhead to show unity.
The letter of invite, or
I think that's the follow-up letter if you wanted to show support for one of the legislative priorities. If you couldn't attend Hill Day, if you wanted to still correspond with your congressional representative or senator, a standardized letter on NBNA letterhead or stationery to show unity for a particular issue or item that we're advocating for.
okay. For anything dealing with the official letterhead and our logo must be approved through our national office. So I will take up that issue with Dr. Gorham to see what might be done to meet the request. However, the request letters for appointments, I want to point out from a member perspective, I have found in my experience that those letters mean more to the representatives if, in fact, they are coming from their actual constituents in terms of requesting those appointments. And as you see, the letter does state your affiliation with NBNA, and we do ask that you add your local and personal information. But for sure, the appointment letters being a little bit more unique to you as a member requesting that appointment is a little bit more impactful. As Dr. Phillips pointed out, the follow-up letters and the thank you letters that have that consistent format with the letterhead might be and are more appropriate. So, any other questions, Nina, or statements?
Nope, that's everything.
Okay, so in terms of next steps, as you can see on this slide, again, we're encouraging all chapter to send representation. The health policy chair, the president, if possible. We encourage the participation of students. We encourage you all to review this webinar and the information at your next chapter meeting. And again, collect that local data from your district or your state. I would also highly recommend that you look at either your local city or state health department for data to support the important issues that will be important to your particular representative. Dr. Phillips?
Yes, we thought it was very important to have this slide here talking about taking the message home, meaning that, Hill Day is one day out of the year that we visit our legislators together, but it's very important that we stay in contact with our legislators once we return home. It's sort of like building a relationship. I know for me, I've been able to stay in contact with Representative Robin Kelly. I was able to do a press conference with her on maternal mortality. I volunteered for one of her local events. And so I think that that's extremely important so that people don't forget who you are and what you're advocating for. And sometimes there are opportunities to be more engaged on a volunteer basis, particularly serving as an expert or a volunteer in some capacity. Plan to visit them in their local office as a chapter. Again, taking the message back home and visiting them when they are home on their breaks or what have you. Share the toolkit and continue to advocate for all 5 legislative toolkit items. We know that it takes a long time to get these things addressed, and so advocacy is always in season. Send a note of thanks to those that you met with when you were on the Hill. And again, volunteer to serve in some capacity, either as a content expert on a health-related matter, or just keeping the office abreast of what's going on with nursing or with these healthcare topics. So it goes a long way in terms of building that relationship so that the office will begin to recognize that they are credible members of the NBNA throughout this country.
Thank you, Dr. Phillips. So, colleagues, again, thank you for your time. We truly do hope that this webinar has been helpful in preparing you all for our annual Day on the Hill. Again, we encourage you to take the information back to your chapters as leaders. The webinar is going to be made available to the membership so that they can review it as well. And I just want to end the webinar this evening with this slide of acknowledgement for the Health Policy Committee and the members who have been working very diligently to put together all of the information that you have seen this evening. And we worked with the office, particularly with Dr. Gorham, in setting up the day. So if you know these members, please thank them for their service. I know that myself and Dr. Phillips as the co-chairs are very thankful for their assistance. And again, we hope that this evening the information you have found helpful. If there are any other follow-up questions, you can always still send those emails or anything to myself and Dr. Phillips. I think it's very easy to find us via the national office as well. So, Nina, any last-minute questions or anything that's come in?
Just a lot of praise for you guys.
Okay. So on that note, colleagues, it is 7:58 p.m. Eastern Time. I promised you that we would be done within an hour, and we have met our goal.
So actually, there's one more question here that sneaked in. Will the slides be emailed to us for discussion at chapter meeting?
I do not have a problem providing the slide deck to the national office, and I will do so, and it can be distributed.
And this is being recorded, so once we finish, it will be available to people. I believe it'll be sent out probably through an email.
Okay.
But we will keep you guys updated on that.
Yes, yes. And again, thank you everyone for your time. One last acknowledgement, of course. Nina, thank you for your assistance. This could not have been done without you.
All right, thank you. Good
On
night,
that
everybody.
note, on that note, good night, everyone.
Thank you, everybody. Bye-bye.